The Alliance for Suicide Prevention prevents suicide through training and education, providing outreach, and offering support. My name is Scott Smith, and I'm the outgoing Executive Director at the Alliance for Suicide Prevention of Larimer County.
Hi, I'm Kim Moeller. I am a licensed professional counselor, and I am the new Executive Director for the Alliance for Suicide Prevention.
I am Rachel Olson. I use she, her pronouns. I'm one of the program directors here at the Alliance for Suicide Prevention. I have been overseeing the Imagine Zero Coalition and the work of the Colorado National Collaborative.
The Alliance for Suicide Prevention has been around since 1989, and originally when we started, we were a very small nonprofit with 1.5 part-time people. We did a lot of support groups and education in schools mostly.
Since then, the Alliance has grown quite a bit. So in the last 3 or 4 years, we've increased staff from 1 to 1.5 all the way up to 10 different staff members. During that time, we've also increased our outreach, the number of people served, and our budget so we can sustain these operations for the future.
The level of impact that we've been able to have in our community has absolutely grown through the years as we combined the two organizations, Imagine Zero and the Alliance for Suicide Prevention back in 2019. Our reach has really expanded across the community. So I think as we've brought on new team members, as we've had different focus areas, as we've been able to expand our training, we've definitely been able to outreach to more people in our community, and that continues to grow with the awesome team that we have built.
All of the programs that the Alliance for Suicide Prevention does are completely free. So we have 4 main program areas. The first is adult education. So annually we train between 4,000 and 6,000 adults in Larimer County every year. Our main program is called QPR, which stands for Question, Persuade, Refer. In addition to that, we also do youth education. So every year we train between 5,000 and 10,000 youth in middle school and high school, and this upcoming year in elementary school in suicide prevention. Similar to QPR, but more having a teenage bent for youth and young people. And we also work with youth to help design the program so it's more interactive and engaging for them, because they know how to communicate with themselves the best. We also offer grief support. So we offer a couple different support groups for people who've lost a loved one to suicide. We offer an in-person group. We also offer a virtual group, so transportation isn't a barrier. We also offer peer outreach. So currently we have an LGBTQ+ outreach coordinator that provides all sorts of peer work, kind of as a clearinghouse and a central location where we can organize some support groups and work groups and focus on local LGBTQ+ support issues. And lastly, we're part of the Colorado National Collaborative, which is this big national, state, and local partnership. The idea is that it's a public health upstream approach. So in suicide prevention in the last 30 years, there wasn't one thing that was shown to be dramatically successful to drastically reduce the suicide rate. But there was 40 or 50 interventions that we saw that moved the needle a little bit. So the theory behind the Colorado National Collaborative was, what if we try all of those 50 some odd interventions in one community with the goal of reducing suicide by 20% by 2025.
I focus a lot on making sure that the LGBTQ+ community has access to resources and that we're creating just greater inclusivity within Larimer County. And so that's why the work group and these trainings are really important. Reducing suicidality within this population of LGBTQ+ youth really requires us to be training adults who are serving youth, interacting with youth, and together we're working to create even greater inclusive measures for the LGBTQ+ population.
I prevent suicide because I teach in schools. So I teach them, how do I know the signs and symptoms of suicide? What should I do if I'm worried about myself or someone else? What are my resources? How do I talk to someone? And how do I take care of my mental health to have extra protective factors in my life when things are hard?
One challenging thing about this position is that you do offer a safe space for students to oftentimes share difficult things that are going on in their lives. And you want to be empathetic about that, and you will hold space for that pain that they have, and that can be hard. But we also couple that with like positive psychology, so identifying your protective factors in your life, identifying your coping skills, how to use them, remembering to use them, how to talk to your friends and family about difficult things.
When we're presenting to 7th graders, they're holding on to that information all the way through their high school years and making sure that people know that those changes are happening, even though they're small, they are profound. The most challenging thing about running the Alliance for Suicide Prevention is that change takes time, and knowing and seeing that change, it doesn't happen in a year, it doesn't happen in 2 years.
So in prevention work in general, you don't hear a lot of success stories. So that's precisely why when we do have some successes, we really need to celebrate them. And one of those successes has been the reduced suicide rate consistently over the last 3 years.
It feels a little bit miraculous to know that the impact that we're having on our community and how we are seeing suicide rates decrease, and how we're seeing more and more people reaching out for education, more and more people accessing resources. Like, it's just such a beautiful experience to witness our community grow and come together to fight suicide.
I think the most rewarding experience that I've had since I've been at the Alliance is really just watching and partnering with the community to enhance and support our growth as an organization.
Imagine Zero Coalition started with an amazing small group of 8 to 10 people and expanded over the years. Now we have over 2,000 people and over 40 agencies. And to really see this work get embedded in the community has been so rewarding for me. I think we're on a really fantastic, steady course of growth and reach in our community. I think obviously with our transition of leadership and new staff coming in and out, there's always room for growth and opportunities to do things better and differently. So I think we have created such a solid foundation of people knowing that they can count on us in the community, and I hope that that just continues to expand.
The Alliance for Suicide Prevention is very excited to be rolling out this year a program called the Survivors Fund, and what we're doing is we're working to raise funds to support loved ones after the loss of suicide. We know that the impact and the financial burden that people face after losing a loved one to suicide is significant.
Whether that be a hotel room, gas money, groceries, cleanup services, or anything they might need, even help with funeral costs. This is an extreme burden on people that have just gone through a horribly tragic event. And currently there's no services that offer financial support for those folks in Larimer County. So we're trying to fill that gap. That's why your donation is extremely important to the Alliance for Suicide Prevention.
The Alliance for Suicide Prevention offers all of its program for free, all of its resources, all the materials, everything that we are offering the community, we are offering to them at no cost. And that's why donations are so important and such an important piece of our programming. Programs like the Survivors Fund are not grant funded, and they are based on donations and the generosity from our community.
Please consider supporting the Alliance for Suicide Prevention today. You can donate at our website, www.suicideprevent.org.
But we also are doing education in elementary schools now. We're doing education with adults at a much larger rate. We have a much bigger outreach presence, and so we are also, they know that it's okay to ask for help, and they know where to go for help. So ideally, the Alliance for Suicide Prevention will never ever have to exist in the future, and we will always be here to support our community through the challenges that come with life. All right.
Isn't that like the legal definition of a nonprofit?
Mm-hmm.
some sort of definition.
That's
I
what,
like
like,
that's cool.
and like all nonprofits have a vision statement, and like the vision statement really is like, how will you know when your work's done?
Yeah.
So like you're not needed.
Okay. I feel
Future of ASP eventually to work itself out of a job. In the nonprofit world, we're always trying to work ourselves out of a job. I would love for there to be a day when the Alliance for Suicide Prevention is no longer needed.
Good. That was really like simple but straight to the point.
Cool.
I like that.
Is out of a job. I would love for there to be a day when the Alliance for Suicide Prevention is no longer needed.
Good. That was really like simple but straight to the point.
Cool, good.
I like that.
Yeah.
That's actually more video friendly.
I know. Saving care that they need. All of our trainings are completely free. Information can be found on our website, and you can sign up for one today. Additionally, if you're part of a group, club, or business, please get your colleagues, friends, neighbors to take this training. The more people that are trained, the more lives we can save.
That was it from the list.
I don't know the actual year we started.
A question where we talk about the merging of Imagine Zero.
Oh, sure, yeah. I got involved with the Alliance for Suicide Prevention back in 2019 when the Imagine Zero Coalition and Alliance for Suicide Prevention decided to merge. We were two separate organizations, both working in the whole same sphere of suicide prevention, but in very different ways. And it was a perfect symbiotic relationship when we could check in with yourself and check in with others and really be honest about it. It's really hard to be vulnerable sometimes and tell people how you're really feeling. But as soon as you open up, you'd be amazed at how comfortable you make it for others to be able to share what they're going through. So the more comfortable you can get about asking people how they are, and then listening intently and apathetically and not apathetically, and compassionately, listening compassionately, that can make all the difference in